Welcome to the Go Red for Women, Go Red for You online learning series presented by UW Health. UW Health has been a proud supporter of the American Heart Association's Go Red for Women movement for more than 6 years, and our goal by producing this online series is to help women and men from a broad geographic area become heart healthy. Today you're part of a community that covers many miles, so thank you for joining us. A couple of quick housekeeping notes before we begin. If you would like to ask the presenter a question during the live presentation, simply use the chat room feature at the bottom of the screen. Questions will be answered at the end of the presentation. Before we get started, we'd love to know how many people are participating today and where you're from. Please use the chat feature now to let us know where you are and how many people are a part of your group. The presentation will also be recorded for viewing at a later date and can be found at uwhealth.org/GoRed. And finally, your feedback is very important to us. After the presentation ends, questions and comments can be emailed to gored@uwhealth.org. Now I'd like to introduce our presenter, KJ Bussey, nurse practitioner for UW Health Preventive Cardiology, who kicks off this online learning series with Go Red for You, Know Your Risk Factors.
Thanks, Beth. It's exciting to be here and welcome. It's nice to be able to kick off this program as the first of our lecture series to give you more information about what heart disease is and why it's important to worry about how you can help your heart be healthier. So to just get started, a little bit of a background here. Heart disease is the #1 killer, but only 1 in 5 American women believe that heart disease is actually a great health threat. It's more deadly than all forms of cancer, and in reality, 1 in 3 women die from heart disease. And interestingly enough, women are less likely to call 911 for themselves when experiencing symptoms of a heart attack than they are for someone else. I've had several experiences where patients have actually had situations where they feel that it's something else and they decide not to call 911 thinking that they'd be embarrassed if it ended up not being 911. So it's important to pay attention to your symptoms and call 911 if you're having symptoms. So what is heart disease? It's a now problem. It's not too soon to get started on working on reducing your risk factors to help with preventing heart disease. Later may be too late. Heart disease is something that can be permanently damaging to your heart and your life. So today I hope to discuss with you what heart disease is, symptoms of heart attack, how to survive a heart attack if you're having symptoms, but more importantly, we'll talk about risk factors that you need to know about that can help improve your life and help reduce your risks, and hopefully things that you can take along to other women and friends that you know to help prevent their risks for future problems too. Also, I'll give you some suggestions about talking to your doctor, and then at the end we'll have some resources. So what is heart disease? Heart disease is considered coronary heart disease, and it affects the arteries of the heart that supply blood to the heart muscle. And if those blood vessels are decreased or have blockage in them, they're not getting enough nutrient-rich blood that actually helps the heart muscle function appropriately. It's chronic. It develops over years. As we age, buildup develops, and it turns into what we call atherosclerosis. And what happens with that is the arteries harden as cholesterol and fat and other substances build up in the artery walls. It's similar to having a pipe that fills up with buildup of calcium deposits or whatnot. They start to not flow as easily, and therefore you have a decreased blood flow to that heart muscle, and that blockage can actually result in a heart attack. It's not a quick fix either. If you have this blockage, it worsens over time, and it can lead to disability or even death if the heart attack is severe enough. And it's something, too, that's not just fixed by surgery or procedures such as bypass or angioplasty. Your risk factors are still there, and if those aren't controlled or modified, you can end up developing blockages and issues once again. So what are some of the early symptoms that can happen when you're developing this heart disease? Women might start feeling a sense of fatigue. They might start having some sleep disturbances. You might feel some shortness of breath. Typically, these happen about a month or so before the events start. Some women start noticing that they have a sense of decrease in their endurance levels. They're exercising. They're starting to feel a little bit more tired, and they start to feel that they can't do as much as they used to. Rarely do women actually have a true chest pain or chest discomfort when they're first having early symptoms of the heart disease itself. So some of the heart attack warning signs to be aware of can be chest discomfort, but that's when it's getting more acute in nature. It's usually in the center of your chest. It might radiate to the left side of your arm, might go up into your jaw or neck. Some women have it in their back. Oftentimes, people will often have a back sensation that doesn't necessarily associate with chest pain. Other symptoms are shortness of breath. For example, if you're exercising and you're feeling more short of breath than you used to in the past, that could be a symptom, even though you might not be having the true chest pain. Other symptoms might be sweats, increased sweating during exercise or activity. Some women have nausea or lightheadedness. I've had patients tell me that they never had chest pain, but they started having increased symptoms of reflux and heartburn and indigestion that they just thought it was exactly that, indigestion. So to survive a heart attack, if you're having these symptoms, make sure you call 911 immediately within 5 minutes of those onsets if it's something that's not what you typically experience. Do not drive yourself to the hospital, and don't worry about being embarrassed if this ends up being nothing. It's better to be checked out, have it be nothing, than have it go untreated and have it be something. So plan ahead. If you know you have a heart disease history in your family, think about some of your risk factors are and learn these warning signs. The good news with all of this, though, is that 80% of this can be prevented or controlled by modifying and managing your risk factors. And I'll get into those in just a minute. But the treatment may also include medications if need be, but the key factors for prevention or risk reduction or early onset of heart disease and preventing that early onset is managing your risk factors. So just an overview briefly of what the ABCs of prevention are is avoiding tobacco if you smoke. Tobacco is very irritating to the vessel linings, helping build up faster of all of the cholesterol and fats that I mentioned earlier. Making sure you have good blood pressure control. Making sure your cholesterol is under control, making sure you know your numbers, and I'll get into that in a little more detail. Controlling stress. Stress is a big factor that impacts blood pressure. It impacts hormones that can negatively impact your metabolism. It impacts your sleep values, and all of that ties a role in how your risk factors are also managed. Excuse me. Diet that's healthy, such as low in fat, high vegetables and fruits, and also high fiber. If you have diabetes, making sure your diabetes is under control. If you don't have diabetes but you have some elevated blood sugars and you're in that pre-diabetes stage, trying to get that improved so that you're reducing your risks even further. Making sure you have a desirable weight. And then, of course, exercise is also a key factor with risk prevention, or risk reduction, I should say. So heart disease risk factors, there's two groups. There's modifiable and non-modifiable. The non-modifiable you'll see is your family history. You can't change that. If you've had male family members that have had heart problems before the age of 55 or females that have had problems before the age of 65, that increases your risks for premature heart disease problems. Your age, you cannot change that, or your gender. Those factors play into this and increase your risks, but more importantly, the modifiable risk factors definitely make a difference. And you can see those on the other side of the chart with the high blood pressure, again, as we talked about, the high cholesterol, the smoking, your weight, diabetes if you have that, and then physical inactivity actually increases your risk factors as well. So blood pressure, how do we deal with that in reducing risks? A little bit about blood pressure. There's a systolic and a diastolic. That's the top number and the bottom number when you get your readings of your blood pressure. That basically tells us how well your heart is resting and how well your heart is pumping and how hard it has to pump. The optimal goal is less than 120/80. If you're starting to see your readings getting into the 130s and 140s on that top number, we start to consider that as prehypertension. High blood pressure impacts your risk factors because it irritates the inside vessel lining. And when that gets irritated, it makes it easier for your bad cholesterol and fats to build up. When you have that buildup, that's when your vessels start to become more stiffened and less compliant, and therefore actually increases your blood pressure even further and making it harder for blood flow eventually to get to all the places it needs to, whether it's your heart muscle, your organs, and your lower extremities, your legs, your arms, and whatnot. When you start to get into the 140s, that becomes even more of an issue and more damaging to the blood pressures. So if you're seeing that you get these readings periodically at office visits, or if you stop at the grocery store and get checked on one of the machines, or you have employee health services where they have options for you to come in and get your blood pressure checked, you might want to take these readings back to your doctor to talk to them further about whether or not you need to do something more about treating this, whether it be with medication or lifestyle changes to help improve blood pressure. So making sure you're getting it checked at least yearly is a good place to start. Healthy cholesterol. There's lots of different variations of readings and goals that we work for cholesterol. What we first recommend is making sure you know what your numbers are. So getting your cholesterol checked at least every 5 years, starting at the age of 20. If you have other risk factors, such as family history of high cholesterol or heart disease, or if you have other diseases such as diabetes, having those checked more often is going to be beneficial for you to stay on top of those numbers and to make sure you're getting them under control to reduce your risks. General numbers that we typically go by for cholesterol is that we want the total cholesterol less than 200. Triglycerides, we like to see those less than 150. Those are fatty particles that are impacted by your food choices, such as high sugar count, alcohol, carbohydrates that are refined, like white breads, white rice, pastas, high content of those sugared beverages such as juices and pops. All of those negatively impact triglycerides and raise those up. Sometimes there's genetic factors that raise those triglycerides as well. All in all, though, those are still impacts that negatively impact how your cholesterol is managed, and those should be followed. HDL cholesterol is your good cholesterol. That's the workhorse of going out and collecting out the bad cholesterol in your system. I like to think of them as being garbage trucks that pick up your garbage. If you don't have enough HDL cholesterol, then your cholesterol numbers of your bad numbers are going to be higher. So for women, in order to have some good protection from heart disease, we like to have their HDL cholesterol greater than 50. For men, it's greater than 40. Your LDL cholesterol, as you've probably heard, is your bad cholesterol. There are variations of goals, so make sure you talk to your doctor about what an LDL number would be appropriate for you. And again, if you have too low of an HDL, that's an increased risk because you don't have enough of the good cholesterol to help clear out the bad cholesterol. And again, if you have too high of an LDL or too high of a triglycerides, then that ends up being in your bloodstream and leads to buildup in your blood vessels where your arteries stiffen. And again, where that buildup occurs, that's where you start having problems with decreased blood flow and potentially developing heart attack. Smoking cessation is very important. Smoke is irritating to the vessel lining and again speeding up that process that helps build up and lead to plaque in your arteries that decreases the blood flow. So if you're smoking, try to work on setting quit dates and goals. Try to talk to your provider about different ways that you can use treatments for smoking cessation, such as lozenges or the gum or the nicotine patches. There's medications out there that can also be used. There's alternative therapies such as hypnosis or acupuncture as well. Quitting cholesterol also may improve your cholesterol numbers. Smoking actually can reduce your HDL cholesterol numbers, therefore giving you further risk that way. Body mass index, this rolls into what your ideal weight is. And body mass index is just a relative indicator of the body fat related to your risk of disease and death. It's a calculation that's taken by your height and weight. And the parameters for whether it's considered a normal weight, overweight, or obese are there on the screen as you can see. This is measured by doing calculations, and optimal goal is to be less than 25 for a BMI. Unfortunately, this doesn't always take into consideration your height and weight and to where you carry your extra fat. So you've probably heard of people talk about the apple shape or pear shape of your body. And so, for example, you can have someone that weighs the same amount and the same height, and if they're carrying more of their weight up in their chest or down in their hips, they have less of a risk than if they have an increased waist circumference. So BMI is one way of determining if you have an ideal weight. However, another risk factor to look at is your waist circumference. And I'll come to that in a second. So if you're interested, though, in calculating your BMI, you can go online, and there's lots of different BMI calculators that you can type into a search engine and determine what that is. For women, for waist circumference, you want to have a waist circumference less than 35 inches, and that is measured at the crest of your hips right below your belly button. So moving into diet and things that can make an impact on your cholesterol is your food choices and if they're appropriate food choices. So you want your diet to be high in fiber, several of fruits and vegetable servings daily, and we do have a dietitian that will be doing some information later this month that'll be more detailed, but just to get started, looking at least 5 to 6 vegetable servings, omega fatty acids through fish oils, whether it's supplements, having several servings of fish throughout the week, and this fish need to be higher in fat such as salmon, tuna, mackerel. Making sure you're having a low saturated fat, definitely low sodium. High sodium diet increases your blood pressure, increases risks for, again, injury to that blood vessel. Reducing refined carbohydrates. As I mentioned earlier, the products that tend to be more refined are going to be your white rice, white pastas. I like to think of things such as a Ritz cracker versus a Triscuit. Your Triscuit's much more fibrous, takes longer to digest. It's going to be less likely to raise your blood sugars, less likely to raise those triglycerides, therefore giving you better control of your cholesterol and your risk factors. Reducing alcohol, no more than 1 drink a day. Alcohol does also increase your blood pressure. It increases weight. It's an excess calorie. Doesn't really have the nutritional value. Increases blood pressure. And for women, no more than 1 drink a day is most important. And then getting into exercise and trying to get motivated, trying to come up with ways to get exercise if you're not. Think about it from a weekly perspective. Can you exercise 2 days 1 week, maybe next week it's 3 days a week? And trying to get into a routine where the ultimate goal is where you're exercising at least 30 minutes 5 days a week. And that exercise should be moderate intensity activity. So what that means is a brisk walk, or maybe swimming, or dancing, like some of the classes that are out there now, like the Zumba classes. And if you can, trying to get into more vigorous exercise where you're getting your heart rate up even further, trying to get that maybe 20 minutes, 3 days a week if you can't do 5 days a week. For weight loss, however, you need to have more around 60 to 90 minutes of daily exercise of that moderate intensity. Some people find it motivating to use techniques such as a pedometer where you can track your steps. Where that, we would recommend doing 10,000 steps daily. Maybe journaling what you're doing as far as a motivating factor, or exercising with a friend so that you're staying on track and exercising on a regular basis. Some weeks are going to be better than others, but don't give up and give yourself credit for what you do achieve. Strength training is also important to help with increasing muscle mass. That helps with reducing weight. So when you're thinking of strength training, think of 8 to 10 exercises that work the upper body or the lower body. Try to stick with the 8 to 12 repetitions and in doing that at least twice a week. So just a review of 6 steps that you can think of that are going to lower your risk is knowing your numbers. What is your blood pressure? What is your cholesterol numbers? Be physically active, at least 30 minutes, 5 days a week for that moderate intensity activity. Following a healthy eating plan to maintain a healthy weight. If you smoke, stop smoking. If your blood pressures are elevated, if your blood sugars are elevated, making sure that those are well managed. Goal for non-diabetes is less than 100. If you do have diabetes, then you're looking for a blood sugar average, which is your hemoglobin A1C, to be less than 6.5%. Taking medications if it's prescribed to help with cholesterol lowering and blood pressure management. Have a heart-to-heart with your doctor. Ask about your risks for heart disease. Discuss your family history. Ask them to help calculate what your risks might be for heart disease development. Drop a list of questions before your visit. Perhaps today's conversation will help you think of questions to ask your physician. When was the last time you had your cholesterol checked? Are my cholesterol numbers at goal for where I should be based on my age and gender? Write down and record what your physician says. Don't hesitate to take a recorder with you if need be to keep track of those recommendations that they make. Tell your physician about your lifestyle, such as smoking or physical inactivity. Maybe come up with a plan together that you can do that will help you stick to it and be successful. and tell your doctor about any symptoms that you may be feeling, such as the fatigue or feeling decreased energy or some shortness of breath. Those might prompt to have further testing for evaluation. Stay on track. Do your changes. These aren't quick fixes. Start with small goals and build up to them. Set realistic goals. Maybe consider working with a buddy. Don't worry about a slip. That's life. It happens. You'll get back on track the next week. And reward your successes. Maybe keep track of it on a calendar, and when you reach those goals, then you can reward yourself with something. Be your own advocate. Ask questions and seek information from your providers. It's up to you to protect your heart today. Start today. And some next steps is to contact your office. You can go to further learning series of the Go Red for You campaign that we have going on, and you can check out the below websites as well for further information. And now is the time that if you have other questions, you can send those in to us via the website, and I'd be happy to go over those with you.
Does anybody have any questions? Please feel free to use the chat room feature to ask them. Great. Well, since we haven't received any questions through the chat room, we'll go ahead and close our program. Thank you so much for joining us this afternoon, and congratulations on taking an important first step to becoming heart healthy. If you would like to refer to others to this session or review it again at a later date, again, please. Oh, we do have a question. The question from Laura is, what are some good cholesterols?
Some good cholesterols. If you're thinking about cholesterol numbers, or is there maybe more to the question about good cholesterols? In respects to cholesterol numbers, typically current guidelines are women should have an LDL goal of less than 160 if you have no risk factors. If you have 2 or more risk factors, we start to look at having an LDL goal of less than 130. If you have greater than 20% risk of developing heart disease and more than 2 risk factors, then we start looking at LDL goals of less than 100. For women who have had a heart event or heart disease equivalent such as diabetes, we start to go even lower and would even consider maybe LDLs less than 70.
I think, and so it looks like the question, the follow-up was, what are food sources, or what are healthy fats, I think is the question.
Healthy fats. So healthy fats are going to be your monounsaturated fats. You want to avoid your hydrogenated oils that are going to be high in polyunsaturated fats. Sources of saturated fats are going to be like your red meats, cheeses, heavy creams, heavy dairy products such as that. Your healthy fats are going to be your monounsaturated fats that might come from things such as nuts and avocados, or your olive oils. Those are your healthier fats to go through.
Great. And then Adam also has a question wondering, do a majority of these guidelines also apply to men?
Definitely. As far as your cholesterol values for the LDL, those do apply for men. Your HDLs vary a little bit in that for men we want your HDL greater than 50 instead of greater than 40, where women it's greater than 50. And triglycerides are also the same for men. There are going to be some new guidelines coming out that we anticipate sometime this spring, so definitely be aware for those and watching for those. And at some point maybe talking to your provider and seeing if some of those have changed.
So I was wondering, I thought it was curious when they talked about that women generally will not call 911 for themselves, but they're more likely, if they saw somebody else having a heart event or thought it was having a heart event, that they would call for somebody else. As a care provider for preventive cardiology, what's been your experience in talking with women about what their reservations are for calling for help?
Sure. I think the biggest thing is the fear that this is really nothing. And oftentimes women also will ignore a symptom thinking that they'll get done with something, they have a project to finish. Women do such a great job with trying to balance work life and everything in general, but there's always something on the table. And what we find is these symptoms get ignored, and because we typically don't see chest pain in most women, and it's presented in more of the symptoms like fatigue or the shortness of breath or the decreased endurance, they often feel that it's just because they're out of shape, or they don't want to go in and be a bother and have it be nothing, and then they're embarrassed that they even went in. And what we end up finding is a lot of times is that these are actually true symptoms that need addressing. And I've had more than one occasion where women have come in with these symptoms, and we have done further testing, and we do uncover that there is something going on with decreased blood flow to their heart muscle, and we catch it in time. So as I said before, make sure that if you're having these symptoms, go to your physician, talk to them about them, and consider whether you need testing such as a stress test to evaluate if there is something truly going on.
Okay, we'll pause for a few seconds to see if anybody else might have additional questions that they'd like to chat in. Great. Well, thank you so much for your participation. It looks like we've probably answered most people's questions. Again, if you would like to review this presentation, it will be in the archives, and you can locate those at the website uwhealth.org/go-red. Oh, I'm sorry. We have a question about if there are multivitamins that are good for heart health.
You know, there isn't necessarily a true multivitamin that helps with heart health. I think getting most of your vitamins and minerals through a healthy diet with fruits and vegetables is typically what people need. If you have a hard time doing that, then just a general multivitamin is appropriate. There isn't necessarily one that's better than the other, but just a typical multivitamin instead of taking numerous individual vitamins is just fine and acceptable. Any other questions? Those are some good questions.
KJ, what have you seen in terms of working with women? I know I've always heard, kind of all begins with a healthy woman, that what I've seen is when we've worked with individual women that they really share what they've learned with others, and especially mothers and preparing food for families. In working with people, I mean, what have you seen? What's your comment on that, or what have you experienced with patients as well?
I think the biggest thing is making sure that you stay motivated and that you get started trying to take care of yourself. And I always tell people, if you don't take care of yourself, you're not going to be able to take care of others as well. And that's what's so important with trying to prevent heart disease. It is a preventable disease. And so if you can, prolong the time that you're able to be healthy, then this is now the time to start and to try to stay motivated. And like I was saying before, it's hard to sometimes balance work and stress and life and kids' schedules and all of that, but there are ways that you can still continue to be healthy. And it's been really rewarding to work with women to help them find little steps along the way that can help maintain their risks and actually start feeling good about themselves through little steps with changes in exercise, starting to change diet. And interestingly, if the mom and the woman of the relationship starts making these changes, oftentimes the family starts having these benefits as well and starts making changes that will end up helping them down the road as well. And women are great too as far as being motivators to helping other women and spreading the word and helping support each other. So that's the other thing too, is making sure you have that buddy system. I think that's a really important factor with helping reducing risks too.
One other question. I understood that maybe the age at which men and women experience heart disease might be a little different. And my understanding is that maybe women might experience heart disease after menopause more. Or what can you tell us more about that?
That does change. As you've seen that heart disease in men is at a lower age than women, and the biggest factor is after menopause, you do have an increased risk because you lose a lot of that estrogen protection that we typically have up until menopause. And at that point, when that changes, that's when you start seeing changes in your cholesterol numbers, your HDL levels might decrease, LDL and triglycerides will go up. You start having changes in your weight and your fat distribution through more into the abdomen, and having that increased change through that increases your risk as well. So typically women do have a little bit later onset, but again ends up still being more of a risk factor for them than for men. Any other questions?
Okay, since it's 12:30, I think we'll go ahead and officially close the program. Again, if you have additional questions after this broadcast, you are more than welcome to email any questions or comments about this presentation to gored@uwhealth.org. That's gored@uwhealth.org. You can always view this program later at uwhealth.org/gored. And I hope you'll join us right back here for our next presentation on February 6th, Getting to Goal, Making Lifestyle Changes That Stick. Thank you.